Good evening, people. This is Vichitra Sandal Kumar from VNet Tribe. VNet Tribe is actually a network for women's empowerment, and we have lots and lots of programs and webinars and women upliftment programs are conducted here. And also we have Young Minds Forum and Little Human Valley for kids, and Young Minds Forum is for college students who can showcase their talents here and also earn some money while they are studying. And we have the main thing we have in VNet Tribe is about Women Shakti. In Women Shakti, we have lots and lots of experts in our panels. We have 8 panels: education panel, health and wellness panel, beauty panel, and spirituality panel, SME panel. We have different types of panel here. So we have experts in all the panels. Today, this program is Women with Wings. We have an wonderful guest here. She is our educational panel member. Let's invite her, Dr. Gayathri. Please wait a moment, people. Coming to our live session today. Yeah, she's here. Welcome, Dr. Gayathri, ma'am.
Hi, ma'am. Thank you. Thank you, Vichitra, ma'am. And yeah, ma'am.
How
Yeah, ma'am.
are
I'm
you,
doing
ma'am?
good. I'm doing good.
Oh,
Yeah,
okay,
ma'am.
ma'am. Happy to have you here.
Thank you, ma'am. Thank you.
Okay,
Yeah, ma'am.
people, she is Dr. Gayathri from our educational panel. She is a founder at Flourishing Kids and also an educational therapist. Let's hear from her about lots and lots. Ma'am, can you explain about your career, ma'am?
Yes, yes. Yeah.
Yeah.
So, good evening, all. Actually, very happy to be on VNet Tribe. And I'm an educational therapist. I actually work with kids having learning challenges. I conduct assessments for kids, and after those assessments, I do one-on-one classes for those kids, and I also conduct awareness workshops on learning challenges for parents and teachers. I also conduct kind of full-day workshops for teachers, like how to handle kids with learning challenges in the mainstream classrooms. Yeah, thank you.
Okay. Dr. Gayathri, ma'am, two weeks before we conducted one program about dyslexia, isn't it,
Yes,
ma'am?
yes,
Can
ma'am.
you
Yes.
explain that, ma'am?
Okay, ma'am. Sure, sure. Thank you, ma'am. Yeah. So
Because
dyslexia.
it is a very big issue, ma'am. I heard that many people or many kids are suffering, and even parents are confusing. Is it curable, or what shall we do? Is it possible for my kid to learn or to shine in academic if she or having dyslexia? That kind of questions are rising more and more. So can you explain it, ma'am?
Yes, ma'am. Yeah, sure, ma'am.
Yeah.
So first, what is dyslexia? Dyslexia means it is actually originated from a Greek word, dys meaning difficulty, and lexia meaning words. Difficulty in words, difficulty in the language, actually, the lexia. So it is actually specific learning disorder with impairment in reading. The reading is affected for these children and adults also, whoever has dyslexia. This is a new term for SLD is a new term for this dyslexia. So if they are having dyslexia, the challenges will be especially in like to read the words out, to spell the words, actually to read it out, they have the difficulty. Then to understand the words, the reading comprehension is affected. Then the reading rate, which we usually say is fluency. Those 3 things are the main factors which are affected if the child is having this specific learning disorder. So whether, next going to your question, whether it is curable, dyslexia is a condition. So it's not a disease so that it gets cured with many times I've heard that taking medicines or taking some other treatment or therapy, see, it doesn't cure and it doesn't go away. But if we identify early, if we identify them early and then we address it, we give them strategies to cope with. So they actually cope with it better and they understand what strategies to be used at specific places and specific points also. So that is what mainly dyslexia is all about. And of course, if there is early intervention and there are specific, systematic, direct instructions given to children, definitely they will read. And they will also get to read, they will learn all those strategies. Maybe The reading may be slower, but they will definitely read and they will understand much better, and they will read also much better actually. Yeah, ma'am.
Okay.
Yeah. Okay.
Okay. It's not an disease or something to be weird. It's just a condition, is it, ma'am?
Yes. Yes.
Okay. By
Yes.
following strategies, we can dyslexia students can shine in academics also.
Definitely.
Is it, ma'am?
Definitely, ma'am. Yes. Yes. Yeah, ma'am. Okay,
Other
ma'am.
other than this, what are the courses you are, what are the classes you are taking for kids, ma'am?
Okay, so the main classes I take is like these classes I called it as multisensory reading and spelling classes. So
Okay.
why this term multisensory is that I use all senses together. That is called multisensory. For example, if we are teaching some word to the kid will be actually seeing that word, and they will also have one more component. They will be seeing, then they will be also writing the tactile sensation, the kinesthetic. They will be doing some motion, some activity will be involved with it. So all kind of senses we join together and give activities for these kids so that they can grasp it faster also. They understand it much better. So these are my classes usually. They are called as multisensory classes. And I usually kind of take 3 to 4 classes per week for children. Yeah.
Okay.
Yes.
From which
Yes.
age group you are taking these classes, ma'am?
Yes. I start taking classes from 6 years. When the kid is 6 years, yeah, from the
Okay.
actually like towards the end of the UKG, actually parents can uh, easily identify it. We can actually
Okay.
identify from preschool, but
Okay.
generally it's around UKG. We know that the kid is having some difficulties, and that is high time you come and get help from support from an educational therapist like me. Yeah. Yes.
Okay. Okay. Is
Okay.
there any tricks to identify this, ma'am, this condition?
Yes, yes. So there are some red flags. So with these red
Mm-mm.
flags, we can actually identify whether the child is having some difficulties in the classroom. So for
Mm-mm.
younger kids, like till this pre-primary stage, till UKG, so they
Yeah,
have
they can't say no.
yes, yes, ma'am. So for these kids, they will have difficulty in appreciating the rhyme, even in the
Mm.
nursery rhymes. If they are singing some nursery rhyme, they will actually feel it difficult. They don't
Mm.
understand the words like Jack and Jill went up the hill. That
Mm.
Jack and Jill and went up the hill. They both are rhyming the
Mm.
same, but they can't
Mm.
appreciate it much because they don't
Okay.
understand the. They have difficulty, especially in the phonological awareness part. That is where the
Mm-mm.
difficulty. That is like you have to be aware of the sounds. So there they
Okay.
have some difficulties. Then they will have difficulty in knowing or naming the familiar objects. They would have already
Okay.
known it. It would be there in their home and they know it very clearly. If it is suppose a sofa, a bottle, a
Mm.
spoon, they know it. But if you
Mm.
ask them suddenly, they will take time or they won't remember what word they have to say. And
Mm.
to follow a sequence of instructions. Suppose we are saying them, yes,
Mm.
go to the left of your room, take your bag and
Mm.
take the
Mm.
English book or something. If you're giving like three, difficult because it's difficult for them to follow a sequence of instructions. Then they
Mm.
also have difficulty with the time and space. They don't know like how much is 10 minutes or something. Maybe exact time
Mm.
is difficult for smaller kids, but actually they find it difficult. They don't know like whether they are spending too much on an activity or they're finishing it quickly, and they have difficulty with space also. Everything.
Okay. Hello. Some. Yeah, some
Technical issue, some
technical issue
technical
from
issue
Dr.
from Dr.
Gayathri's side.
Gayathri's side.
Dr. Gayathri, ma'am, can you hear me?
Yeah, can you hear, ma'am?
Yeah, ma'am,
Are
now
you
it's
able to hear?
okay. Yeah. Now it's
Okay.
okay, ma'am.
Yeah. Thank you.
Yeah,
Because
some
I
issues,
think
I
there
think.
there was
Okay,
some
okay.
network issues. Okay. So
Yeah. It's okay, ma'am.
for
Mm.
yeah for
Please
primary
continue,
kids,
ma'am. Yeah.
there will be visual confusion. They will have
Mm.
difficulty to identify letters which are same like B and D, and
Mm.
auditory
Mm.
confusion for these kids,
Mm.
like they will, if they are hearing a word red, they might be
Mm.
thinking it is a reb because they heard it that way. But this is not
Okay.
any issue with the ear or eye problem. There is no problem with
Okay.
the ear because they are not aware of the sounds and they have that difficulty. Then
Mm. Mm.
they
Mm.
start substituting words. They start
Oh,
substituting words, sometimes substitute the letters. They start
mm.
guessing more. For that,
Okay.
any word starting with C is cat,
Mm. Mm.
irrespective of you write it cap or cab or anything, because they know a three-letter word starting with C is cap. So that's
Mm.
how they
Mm.
start guessing because they don't know. Till UKG or something, they would be knowing all familiar words. So they will easily
Mm. Mm.
identify with a picture and they will say it. But now
Okay.
without pictures, there will be text everywhere. So they will have difficulties. Then
Mm. Mm.
they will
Mm.
read in a flat way. There won't be any
Oh,
ups and downs. They will just continue. If it is a question also, they will continue in the same tone. If it is an
mm.
answer also, they will be continuing. So these kind of things are called the red flags. With these
Okay.
red flags, parents can actually understand that that
Mm.
child is having some learning challenges. So these are the
Okay.
flags. And
Mm. Mm.
usually it's not that if you see just for one day or 1 week,
Mm.
but if you're seeing it in
Mm.
the long term, and if there are a mix of symptoms, then we have to
Mm.
actually go and seek help from outside. Yes, ma'am.
Okay.
Yeah.
These
Okay.
are at the early stage, ma'am. You're
Yes, ma'am.
saying at the age of
Correct.
in primary classes,
Primary
the
class.
like
Yes,
first
ma'am.
standard, second.
Yes, ma'am.
Is it possible, or if the parent is not aware during their KG section and first standard, second standard, if they found that in fifth or sixth, is it able to recover from this, ma'am? Or is there any strategy to them also, ma'am?
Okay. Yes, ma'am. Actually, for kids like the senior secondary or secondary
Yeah.
school, for these kids,
Yeah.
like because sometimes we identify only at that stage. So
Mm.
when we start taking those kids also, we actually start only from the foundation skills. We don't
Okay.
start like whether the kid is in fifth standard and they should have learned all these words. We start
Mm.
always with the foundation level. And then next we teach them many study skills for them. The study
Okay.
skills are like they have easy to understand ideas. We give them how to take notes in the classroom, how to
Mm.
easily actually take the time correctly and use the
Mm.
time properly also, because they will be always taking more time to read. So they also
Mm.
need time to understand also. So we'll be teaching them
Okay.
study skills along with this, so the child can
Mm.
easily actually identify their difficulties and then they can progress also. So it's
Mm.
actually we can do for adults also. If they are having any issues for adults also, we'll do the same. For
Mm.
everyone, we'll start only with the foundation skills.
Found
Then
it.
only we can close the learning gap. We can at least reduce the learning gap. Yes.
Okay. Okay.
Okay.
Thanks for explaining, ma'am. Any other thing you want to explain about dyslexia, ma'am?
Yes. The last
Yeah.
thing is that this month, October, is called Dyslexia Awareness Month. Everywhere,
Okay.
like dyslexia, have to be understand. It should be
Mm.
understood with everyone, because dyslexia, as I said, it's not at all a disease. So people should
Mm.
understand that it is a condition. And of course, if you go and seek help, definitely we can give strategies and the child can cope with it. So parents
Okay.
need not postpone it very late. Sometimes the
Mm.
parent will start giving some other classes, or they itself will start sitting down. It's good. But
Mm.
if you see your child is facing some difficulties, please go and get support from outside. Yes, ma'am.
Yeah.
Yeah, that's it.
From the experts, it will be
Yes,
good,
ma'am.
is it, ma'am? Yeah.
Definitely. You have to give an early intervention.
Mm.
Go and seek help outside. Be as early as possible so that the learning gap can be minimized and the child will also be more self-confident. If the kid is already
Okay.
in third standard or fourth standard, they will have difficulties in the classrooms. So they
Mm.
might lose their self-confidence. Don't wait till your
Exactly.
child fails before you have
Mm.
to intervene, even before the child fails. That's the main thing
Yeah.
for kids with learning
Exactly.
challenges. Yes, ma'am.
Okay,
Okay.
ma'am. Thank you a lot, Dr. Gayathri, ma'am, for coming to our live session and explaining about this. And people, dyslexia is not a disease or something to be feared. It is just a condition. We can follow some strategies and we can overcome this. And kids who is having dyslexia can shine more and can shine in academics also. Okay. And if you need any help, please contact Dr. Gayathri. I will give the information in the description box, and please make use of her. And thank you for watching our live and talk. Thank you. Thanks a lot, Dr. Gayathri ma'am, coming for our live session. Thanks a lot.
Okay, ma'am. Thank you, ma'am. Thank you, Vichitra ma'am, for
Okay.
having me over here. Yeah, ma'am.
Okay, ma'am. Okay,
Yeah,
ma'am.
ma'am.
Thanks for coming. Bye, ma'am.
Bye, ma'am. Bye.
Bye, bye. Thanks, people. Thanks for watching. Bye, bye.